Long-term effects. Leukemia. Survivors of the nuclear bombings in Japan demonstrated that an exposure of 1 gray increases the risk of hematological cancer by a factor of 15. Workers involved in the cleanup of the Chernobyl disaster demonstrated a higher frequency of hematological cancers. Solid tumors. Breast cancer in both male and female patients has been demonstrated to be radiogenic. Regions with more intense nuclear fallout from the Chernobyl disaster, as measured in radionuclide soil concentrations, have a higher incidence of all neoplasms when controlled for other factors. Furthermore, other countries that were reached by the radioactive plume from Chernobyl are reporting a higher incidence of all forms of cancer, particularly neoplasms of the stomach, pancreas, skin, breast, kidney, and thyroid. The incidence of these cancers is correlated with the severity of nuclear fallout in those regions. After the nuclear bombings in Japan, an increase in solid cancers was detected, particularly cancers of the breast, lungs, and GI tract. So overall, radioactive exposure can generate solid tumor cancers, particularly in susceptible tissues. Generational effects and birth defects. Animal models demonstrate a higher incidence of Mendelian and multifactorial diseases in the children of radiation-exposed individuals. However, the sample sizes of human observational experiments have not been large enough to detect these diseases. There is no reason that humans would be different from other animals in this respect, but the sample sizes just have not been large enough to detect a difference. There were no detectable associations between parental radiation exposure and child mortality after the bombings of Hiroshima and Nagasaki. Analysis of the children of Chernobyl cleanup workers and childhood cancer survivors have also failed to reveal a significant increase in mutations. Children of families living in the Teka River Valley, which is highly contaminated with radiation, did demonstrate slightly greater rates of germline mutation. Finally, for birth defects, in utero exposure to ionizing radiation is associated with high rates of teratogenesis, spontaneous abortion, neonatal death, growth and mental retardation, and malignancy. Now, of course, that is exposure that's occurring during organ formation. Malnutrition. Children conceived shortly after the bombings of Hiroshima and Nagasaki had higher incidences of non-cancer related disease deaths. An analysis of these deaths indicated that they were most likely related to malnutrition and poor hygiene conditions after the bombings. In the event of a singular nuclear accident or attack, malnutrition will result in a localized population due to contamination of water and supplies, destruction of transport systems, and failure of local agriculture. If multiple detonations occur due to a worldwide nuclear war, hundreds of millions would starve to death because of the food supplies and agriculture would be affected in nearly every location on the globe. Contamination from widespread fallout, changes in the atmospheric composition, and failure of transportation lines would rapidly escalate to worldwide food shortages. In the event of a nuclear winter, the temperature would be up to 10 degrees Celsius colder, light would be reduced, and the atmosphere would be heavily polluted. In this scenario, large-scale agriculture would fail and widespread malnutrition would result. Finally, fallout. Nuclear fallout occurs when a significant portion of the radioactive material of a nuclear weapon is not completely reacted with detonation. Additionally, the detonation of the weapon produces fission products, which are themselves radioactive, and then these are spread by the blast. Local fallout occurs when larger particles fall close to the site of detonation. Local fallout results in higher doses, and it occurs within the first month after detonation, as large particles cannot remain suspended in the atmosphere. Global fallout is the result of small radioactive particles that are carried on the winds to areas distant from the site of detonation. The degree of nuclear fallout is highly dependent on meteorological conditions at the site of the detonation and the area of the fallout. Global fallout occurs for decades after a detonation. However, the global fallout from one nuclear warhead does not provide a significantly large enough dose to have epidemiological effects. Psychological effects. Victims and witnesses of nuclear warfare may experience symptoms of post-traumatic stress disorder and acute stress disorder.